Welcome back to the video book nursing. In continuation of the last topic, today we are going to read hyperplasia, metaplasia, and dysplasia. So let's get started. Hyperplasia is an increase in the number of cells in an organ which results in an increase in the size of the organ. Now, although hypertrophy and hyperplasia are two distinct processes, they frequently occur together and it may even be triggered by the same mechanism. Now, in contrast to hypertrophy that does not involve cell division, hyperplasia it occurs in cells which are capable of synthesizing the DNA and dividing mitotically, and thus it leads to an increase in number of cells. Now, hyperplasia, it may be a result due to number of causes. Now, some of the most common causes are increased demand, chronic inflammatory response and hormonal dysfunction, or compensation for damage or disease, or it may be induced artificially by injecting hormones, let's say the human growth hormone. Now, the hyperplasia, it may be physiological and pathological, each of which we'll discuss below with suitable examples. Now we come to the physiological hyperplasia. Now, the physiologic hyperplasia, it can be further divided into two types, hormonal and compensatory. Hormonal hyperplasia, it occurs as a consequence of excessive hormone stimulation. For example, the proliferation of female breasts during puberty and of the uterus during pregnancy. The compensatory hyperplasia, it occurs in the residual tissues following the removal of organ or tissue. But then the compensatory hyperplasia, it permits the regeneration of the tissues, of the removed tissues and organs. Now the example, regeneration of the liver after the removal of its portion. Now we come to the pathological hyperplasia. It is an abnormal increase in cell division. It occurs due to the excessive stimulation by hormones or the growth factors. The examples include endometrial hyperplasia, which is the hyperproliferation of the endometrium in response to the estrogenic stimulation in polycystic ovary disease, or the exogenous administration of hormones. Another example of hyperplasia, of pathological hyperplasia, is the congenital adrenal hyperplasia due to the increased secretion of the ACTH, which is the adrenocorticotropic hormone. Now, when we see the morphological changes in hyperplasia, there is gross enlargement of the affected tissue or organ at the microscopic level, and there is an increase in the number of cells. Now, we can see the example of endometrial hyperplasia. Now, with this, we come to the metaplasia. So, metaplasia is the reversible change in which one adult cell type is replaced by another cell type. For example, the epithelial or the mesenchymal. So, it is a type of cellular adaptation in response to the abnormal stimulus in which the cells that are sensitive to endure particular cells, they are replaced by another cell which is better equipped to withstand the altered environment. Now, once the underlying stimulation is removed, the tissues, it returns to their normal pattern of differentiation, that is the metaplastic changes, it reverses. Now, the most common example of metaplasia include the squamous metaplasia, columnar, and the mesenchymal. So, squamous being the most commonly observed form of metaplasia in which the columnar epithelium is replaced by the squamous epithelium. Now, this is observed in the respiratory tract of chain smokers, where chronic irritation of the cigarette smoke, it leads to the replacement of the ciliated columnar epithelium by the stratified squamous epithelium. Then the columnar metaplasia, it is seen in Barrett's esophagus, where the squamous epithelium of the distal esophagus, it is replaced by metaplastic columnar epithelium in response to the chronic irritation by the reflux of gastric acid from the stomach. Then we come to the mesenchymal metaplasia. The common types of mesenchymal metaplasia, they are osseous and cartilaginous. Osseous metaplasia, it refers to the formation of bone in fibrous tissue and cartilage, and it can occur in fibrous stroma of certain tumors and the cartilage of larynx and bronchi in certain elderly people. Now, cartilaginous metaplasia, it occurs during the healing of fractures. Now, with this, we come to the end topic, dysplasia. Now, what is dysplasia? It refers to the abnormal changes in the cellular shape and size or the organization. Okay, so the dysplasia, it is often accompanied by metaplasia and hyperplasia, and it consists of expansion of immature cell with a corresponding decrease in the number and location of mature cells. Now, dysplasia, it occurs as a result of prolonged inflammation or chronic irritation. But then, if the provocative stimulus is removed, the changes may revert back to normal. But however, dysplasia, it is often indicative of an early neoplastic process, and it has the potential to progress to carcinoma in situ if the stimulus persists unhindered. So the commonest tissues which are prone to develop dysplasia as a result of chronic irritation, they are the respiratory tract epithelia and the uterine cervix. With this, we come to the end of cellular and tissue changes, the first and the second part.